I mean, the spinal injury group of patients, I mean, they're a very unfortunate group of patients, and they usually have erectile dysfunction. Some of the patients have reflex erections, and the vast majority of these patients will respond to PD5 inhibitors or sildenafil, Viagra, for example. Or in the olden days, they used to respond very nicely to intracavernosal injections. But there will always be some patients that don't. And those patients, of course, I mean, they tend to be younger patients. They have a physical, neurological problem. And, you know, you can always treat patients to get them at least to have or regain their sexual function. So there are patients, they're in the minority in the spinal injury group of patients, but there are patients that then come through that need a penile prosthesis because they failed conservative management. I think it's important that these patients don't tend to have sensation in their penis, and so one thing you would not do is put a malleable penile implant in this patient where they will be unaware that there may be a problem and the thing may erode out through the end. So it should be an inflatable penile implant. Don't oversize the implant to prevent erosion, and of course they need to be warned that the infection risk is much higher because quite often they self-catheterize or they wear convenes and things like that. So it's more difficult a procedure than just in other patients.